Hi, everyone. I'm Dr. Jacqueline Corpix. I am the medical director for the COVID-19 response at the Cook County Department of Public Health. And I am here with Dr. Fagan and Dr. Perez. So just to introduce you, Dr. Claudia Fagan, she was appointed the Chief Medical Officer of Cook County Health in 2013. So in this role, she provides executive oversight for the health system's medical practices and helps inform health policy initiatives. She was also awarded the Soul of Medicine Award by Physicians for Social Responsibility for her work inspiring medical students to commit to careers in social justice, and is the 2017 recipient of the Paul Cornely Award for her work as a healthcare activist. And she also serves as the president of the Health and Medicine Policy Research Group and is the national coordinator of Physicians for a National Health Program. So welcome, Dr. Fagan.
Thank you.
And then we're also joined by Dr. Jennifer Perez Barrett. She is a pediatrician here in Chicago. She went to medical school at the University of Illinois at Chicago and completed her residency in pediatrics at Rush University. And she also is an internationally board certified lactation consultant. So welcome, Dr. Barrett.
Thank you.
So thank you both for being on our Ask a Doctor session. So we just basically are offering time to people to ask any questions that they have. And so we really welcome any and all questions about COVID, especially about the COVID-19 vaccination. You know, they can be general questions, they can be specific to your own health, really anything. We're here just to ask or to answer any questions you have and kind of have a conversation about any concerns or anything you want to know about it all. So one of the things that we were just talking about as we were joining was the requirement in Chicago for to start indoor masking starting this Friday. So Dr. Fagan, did you want to talk a little bit about that?
Well, we know that masking works. If one of the best proofs of that is we know that we had a markedly decreased incidence of influenza over the past winter because so many people were wearing masks. And we know that the most effective thing, while we want everyone to wear a mask, I mean, ideally, the person who is infected, if they're wearing a mask, that protects everybody in the room. And since we don't know who's infected, just all of us wearing a mask is the best way to go. I mean, even if you're vaccinated, if you have an asymptomatic case of COVID, it will protect everyone. So the idea, and the Delta variant is so virulent. In other words, it spreads so easily that we talk about social distancing in 6 feet of space, but we know that if there's somebody in the room with the Delta variant, they could be across the room, and many people in that room will become infected. So the safest thing is for all of us to wear a mask, then we're all protected.
Great, thank you. So we're starting to get some questions, which is great. So Barbara is asking, where can I get a third shot?
So the third shot, the booster shot right now is recommended for people who are immunocompromised. And, so we're thinking about people who have blood cancers, people who have had transplants. And, our vaccination sites are just now trying to get oriented toward giving those vaccines. But we'll be giving them very shortly to at all of our sites, at all of the county locations. We'll be giving vaccines, offering them. So that's our clinics. We've closed the mass vaccination site, but we're offering it to other locations to folks. And I think that Walgreens and CVS will also be offering those booster shots as well.
And I would say reach out to your individual physicians. I'm lucky enough that I've applied and I have COVID vaccine available in my office. So I had a 16-year-old yesterday who is a kidney transplant recipient. So he got his third dose in my office yesterday. So of course your individual doctor can make that decision as to whether or not you qualify for that third dose and can administer it to you as well if they have the vaccine available in their office.
Great, thank you. So we have another question in the chat. So Jim's saying, I am 69 years old and October will be the 8-month mark for my Pfizer vaccine. I'm scheduled for my second pneumonia shot and hoping to get my annual flu shot that year as well. What's the time frame for getting these?
So this recommendation is just, we expect to come out later this week that everyone will be getting their everyone will be recommendation will be for everyone to get a booster shot 8 months after their second shot. So that person who 8 months will come in October, they'll probably be able to go to either their healthcare provider or to a Walgreens or to a county site to get that shot. When the recommendation becomes formal, which like I said, I think is going to be later this week, then we'll start gearing up to give everyone their third booster shot.
And I would just address the fact that very initially when we were vaccinated against COVID, there was a recommendation to not have other vaccine within, I want to say initially they were saying a couple of weeks of your COVID vaccine. And we as pediatricians in the American Academy of Pediatrics fought to have that recommendation removed because we know how backed up kids are on their vaccines. So I will say we have been administering COVID vaccine simultaneously with other vaccine, and that is acceptable to do. I will say there is kind of a trick though. There are certain vaccines where you can't put two in the same arm. COVID is one of them. The recommendation is to not put another vaccine in the same muscle where you're putting your COVID shot. And sometimes meningitis vaccines also have that recommendation. So if you have 3 vaccines due and you only have 2 arms available, sometimes you may have to spread out that third shot that you need. I don't think pneumonia or flu shot have those recommendations. So you should hypothetically be able to get those on the same day, but just keep that in mind.
Yeah, so there has been literature published on that we will be able to give the flu shot and the COVID. Some of us were hoping that we'd be able to combine
combo. Yeah. Next year.
We do anticipate that we'll be able to give the flu vaccine and the COVID vaccine together, and it's going to be recommended.
Yeah.
So.
Yeah, we've been talking with a bunch of physicians in Cook County, hoping that they'll offer both at the same time. And then for our mobile vaccination clinics, we're trying to get it so that both can be offered so people can, get both at the same time.
Yeah, so Dr. Perez is absolutely correct, though, that the initial recommendation about not giving the vaccines together has been dispelled, and it is now considered perfectly acceptable to give more than one at the same time.
And I make the point, we give little kids, 4, 5, 6 shots sometimes. So us big folks can probably handle 2 or 3.
Right.
Yeah. Okay, great. So Peter has a question. Israel has one of the world's highest vaccination rates, but now is seeing that 60% of gravely ill patients with COVID were found to have received 2 doses of the vaccine. So if you guys just want to comment on that, and I think just reiterating that we're likely to see boosters approved for everyone in the future. But if you don't mind just commenting again on that.
Yeah, I don't know if that's exactly correct, that there's the most gravely ill are among people who have been vaccinated. That's not the literature I've seen. I do know that Israel has begun already giving boosters to everyone over the age of 60. Our experience has been, now we have to remember that the United States is, although Israel is ahead of us, but has been very good in terms of vaccination rates compared to a lot of places in the world. And so the more that the Delta variant is allowed to multiply, the more virulent or dangerous that strain becomes. And so that is a huge risk to everyone concerned. And I know that's part of why Israel went ahead to decide to start giving a booster to everyone over the age of 60. So we have seen breakthrough infections in the U.S., but those have generally not been serious. Those folks have generally not required hospitalization. And our armamentarium against the virus is much better now, because we know about the things that we can do. We know that we can give people who aren't looking very sick at the beginning monoclonal antibodies, and that seems to mitigate the illness. And that even people who have been vaccinated seem to do very well with the infections and not be the ones who are hospitalized. The ones who are getting really sick and taking up ICU beds and the ventilators are folks who have not been vaccinated. And unfortunately, we're increasingly seeing children who, either weren't eligible to be vaccinated, haven't been vaccinated for one reason or the other, young children and teenagers who are the ones who are getting sick and being quite seriously ill.
And I just think it's a good time to point out, sometimes I hear things from patients that are half factual and half getting a fact confused with something else that they have heard. So to Dr. Fagan's point, absolutely, we do have breakthrough infections in vaccinated folks, people who have received 2 doses more than 2 weeks after their second dose. But again, those who are severely ill and are hospitalized are highly unlikely to be those folks. So I think the last statistic I heard was across the country as a whole, and of course it varies by where you live, but as a country across the whole, 99.2% of hospitalized patients are unvaccinated, and 99.9% of deaths are in unvaccinated patients. So I think there is kind of some confusion and overlap with hearing about breakthrough cases and then hearing about these increased hospitalizations and death. So I think that's an important point that Dr. Fagan made to make clear. You can certainly have breakthrough infection in vaccinated folks, but those do tend to be asymptomatic or mild. The biggest concern and the reason we need to remask is because asymptomatic or mildly symptomatic vaccinated people can transmit Delta, and that is a change from our previous strains. So that's the thing about viruses and science, is that things do change. We weren't wrong before. The virus has changed and is now transmissible in vaccinated folks. So that's why everyone, including those that are vaccinated, need to mask up. But those who are being hospitalized and dying are unvaccinated. And I think some people who are yet to become vaccinated hear about breakthrough infections and it makes them concerned. And I just make the point, if you have 80% protection, which is about what we're looking at with Delta specifically, 80 to 85%, you're never going to test positive for COVID. I would say to my patients, an 80 or an 85 on a test is much better than 0. And 0 is what you're walking around with if you're completely unvaccinated. So of course, you're at risk for breakthrough vaccination with being vaccinated. But of course, that risk is substantially lower if you are vaccinated.
Yeah, that kind of gets to one of the comments in the chat. Mask on, mask off, mask on, mask on. Why are we seeing this back and forth?
Yeah, it's exactly that point. So when the pandemic started, everybody masked because our testing was not great. We knew that there was asymptomatic disease that we could spread. And so that's why everyone had to wear a mask. And then prior to the Delta variant, those of us that were vaccinated were allowed to take our masks off in certain situations, in outdoor places, in indoor places when we knew we were with other vaccinated folks, because with the previous variants, we were not able to spread asymptomatically the disease to other folks. So now Delta is much more contagious than our previous strains were. There is up to 1,000 times more virus in the oral pharynx in folks who have Delta. So hypothetically, up to 1,000 times more contagious than our previous strains. So because of that change in the virus itself, that is why even vaccinated folks need to put their masks back on. So there's 2 points to be made. Number one is that the virus has changed and it is more contagious and it is able to be transmitted even by vaccinated folks. That's number one. Number two is there is so much Delta circulating because there are so many unvaccinated folks. So there's 2 points there. It's highly contagious and we have way too many people that aren't vaccinated yet. And those 2 things together are the reason that everyone has to mask up again. So if you want to get to a place where we need less masks, wear your mask so that you aren't a spreader and get your vaccine.
Yeah, vaccine is definitely our best defense. So Amy,
I think the only way we're going to get out of this, and it's the only way we're going to get clear. Masking will help protect us, but it's not sufficient. It's not adequate. And unfortunately, wearing a mask or not wearing a mask has become more of a political statement than a public health, uh, public safety. I say, people say, well, it should be my choice. I should get to decide whether I get vaccinated or not. But, it really is a public health issue. And if we're going to live in society together, then we have to do certain things. I mean, if you drive a car, you don't get to decide whether you run the red light or not run the red light. I mean, it's a requirement. And so we have to get vaccinated so we can protect each other. None of us are safe until all of us are safe.
Correct.
It's just that simple.
So Amy's asking, as of 5 days ago, Lollapalooza was not considered a super spreader event. Is that still the case?
Yeah, the number of cases that we have seen out of Lollapalooza relative to the number of people who were there is small. So there were a few hundred people who became infected, and they were in very close proximity. A super spreader event, we had literally hundreds of thousands of people in a very close space. Even though it was outside, they were very close to each other. And the Delta variant, we know, can spread when we're in close proximity. So it's still not considered a super spreader event. But remember, we require people to be either vaccinated or have proof that they had tested negative for COVID within 72 hours. The incubation period for a Delta variant is 3 to 5 days. So I think we did a good job in trying to keep people who were infected out. But there's obviously could have been people who had been vaccinated and not symptomatic who had COVID, who spread it. That is more often the case with people who are vaccinated. And as Dr. Perez mentioned, the viral load is so high, with the novel virus, the initial COVID virus, people who were vaccinated couldn't really spread it because they didn't have that high a viral load if they were to break through. But now, there's just so many more virus particles that everyone's a spreader once they're infected.
There's a couple questions in the chat kind of getting on kids in school. So, we know Delta is dangerous, but is kids going back to school in person, is that a good idea?
We know how important in-person learning is for kids. Those of us who do outpatient pediatrics, I have seen extraordinary suffering in my kiddos and in their families from a year and a half of being at home. And I have seen the difference in families who did have opportunities to send their children to school. And we know how extraordinarily important the learning is, the socialization is. So it's really important that we do our absolute best to get kids back to school. Now, again, that being said, that doesn't mean we're going to do it carelessly. Thank goodness we have a state mandate for masks indoors in schools. That's going to be extraordinarily important for our mitigation strategies in order to keep kids safe and to keep schools open. So you have to think of everything that we do to mitigate COVID is a layer of protection. So layer number 1 is for everybody 12 and over to be vaccinated. Layer number 2 is those masks in the classroom. Layer number 3 is your hand washing. Layer number 4 is distancing where possible. I would urge parents to be prepared to get that letter that there's a positive case in their classroom, in their school, in their sports. That is going to happen. And the goal, I would say, is not to have 0 cases of COVID in school. It's to have the lowest possible amount of transmission of COVID inside of schools. And we know from the schools that were open in other parts of the country, or even here in Illinois, in private schools and Catholic schools, in suburban school districts that did have half days or even full days, that in schools where you do masking, you're going to have less spread of COVID. We can already see in places like Texas and Florida where masks are not mandated in school and schools have already opened, that there have already been outbreaks and quarantines of schools. So again, please don't think of your mask or your vaccine as a political statement. These are all layers of protection that we need to do to keep our kiddos safe. So that means teachers, staff, that means parents, grandparents who pick up and drop off kids, especially those of us who are parents of kids who are too young to be vaccinated. And I know there's a concern there, especially amongst parents of 10 and 11-year-olds who are so close and wanting that vaccine before they send their kid back. Guess what? The next best thing that you can do is get yourself and your family and everyone who's going to be around your kid vaccinated. Be very aware of what you do when you go to the grocery store, when you go to the gym, when you spend time with family and friends, to be wearing masks indoors or to be spending time with people outside and at a distance, to keep your unvaccinated children over the age of 2 when they're out in stores or with their friends with their masks on so that they're not getting infected, they're not taking it back to schools. It's the responsibility of all of us to keep our schools safe and open for the health and wellness of our kids, academically, emotionally, and physically.
Thank you. Yeah, right around the last Ask a Doctor, the recommendation did change from recommending masks in schools for anyone who is unvaccinated, but now universal masking is recommended by both the CDC and the American Academy of Pediatrics, who came out with that recommendation even before the CDC.
You know, it's we know masking works. It is our first line of defense. We know that vaccines is the ultimate line, and we want to take the right amount of time to make sure that the vaccines are appropriate, are safe for children. Remember that children are not little adults, and we need to make sure not just only that we can give them the vaccine, but what's the appropriate dosage to give them. So I think that we'll get that recommendation probably in September, end of September. But it will come, and in the meantime, we have to use the mask.
Alberto is asking, are healthy vaccinated people getting severely sick from Delta?
Luckily, not severely sick. There are definitely asymptomatic and there are mildly symptomatic folks getting ill from Delta. But I think our statistic in Chicago is, I want to say 94% of hospitalized patients are vaccinated. So obviously if you're sick enough to be in a hospital, those are by and large almost entirely unvaccinated folks. And again, let's keep in mind the immunocompromised individuals in our population who are now eligible for a third dose of vaccine, which again, we're not even calling a booster. We're calling a completion of their series since they didn't have a robust enough response to the first 2 doses. Those can certainly be some folks that are also vaccinated and maybe being called breakthrough and being, admitted to hospitals. They're certainly at higher risk for more severe disease. But healthy vaccinated people are, as generally speaking, not becoming severely sick from Delta.
That's right. I mean, there's always exceptions, but as a rule, those are not the folks we're seeing in the hospital. Those are not the people who are getting ICU. And I think it's an important point. You know, some of these folks who breakthrough did not have a good or an adequate immune response. And people who are on particular medications, biologics that are designed to suppress your immune response, also suppress your response to the vaccine. And so they may not have had as robust a response to the vaccine as a result of medication they were taking to suppress that response.
Yeah, and I think you may see on the media, sometimes they show stories about, people who are unvaccinated and they were hospitalized, but they're still refusing the vaccine. By and large, we as physicians are seeing a lot of regret for people in the hospital who've gotten COVID, gotten really sick, asking if they can get the vaccine now, if that will help them. So it's pretty sad for us as physicians to see, people getting so sick and really wishing that they had gotten the vaccine.
It's tragic. Yeah, it really is.
So John's asking, if double vaxxed, then positive for COVID anyway, months later, and given monoclonal antibodies, do you still need to take a third shot?
Yes, you'll still get a benefit.
You do need to wait for a certain period of time
Right.
after those monoclonal antibodies for the vaccine to take effect.
Right. You'll have to wait 60 to 90 days, but there'll still be a benefit there.
So Wick Mike is saying, you'd think that kids are going to keep a mask on all day. I don't think so.
I will tell you, as a parent of 2 children who were physically in school every single day last year, they sure do. Even the little ones, my kid's school goes down to pre-K 3. You will be amazed what children learn to do, figure out, especially in a school setting when everyone else is doing it and their teacher is kindly reminding them to do so. And young little kids really care about their friends, believe it or not. And when they talk about germs and keeping our friends healthy and not wiping our faces and using hand sanitizer, our school did extraordinarily well. And my kids are a little bit older. Their biggest complaints the first week or 2 was when you have to sneeze and you have your mask on, that it's really gross, which I said, yes, that's a thing. They eat outside and they complained about the bees hovering around their food over those first couple weeks. And for the rest of the school year, I didn't hear a lot of complaints. So there are lots of schools in Chicago that were open all year, and we executed this. So I have great faith that CPS can do it as well.
You know, it's an amazing thing. Kids are a lot more adaptable and resilient than we are. And the littler ones who are growing up with this really adapt to it a lot better than some of us do in terms of the idea of having to wear a mask all the time. It becomes very natural.
And I will say, kids absorb everything that their parents say. I always use the example of talk constantly about how your kid is a picky eater, and I promise you they're going to be a picky eater, right? Whereas if you ignore the picky eating, it tends to get better. Same thing. If you spend your days talking about how wearing a mask is not a big deal and they're going to be able to do it all day, they're going to be sitting in their classroom talking about how, thinking about how their mom and dad said they're going to be able to wear a mask all day. But if you tell them, I had a kiddo who was in CPS, who was in my office last year, who was struggling to keep his mask on. And his mom kept saying, well, it's because he's overweight, so it's really hard for him to breathe in the mask. And he kept saying, yeah, I'm overweight, it's hard for me to breathe in the mask. They absorb what you tell them. And if you tell them the opposite, they absorb that as well. So set that positive role modeling by wearing your mask and by making it look as it is, like a very simple thing to do that you get used to very quickly, and you will be very impressed with what your children can
do. John is asking, I think we may have answered this before, but just to reiterate, how long after monoclonal antibody can you be around others?
Well, it's not the monoclonal antibodies. If we're giving you monoclonal antibodies because you're infected with COVID, we still don't want you around other folks for 10 days, right? If you're feeling better, if you have symptoms, it's longer, right? We want you to be free of fever, you're not feeling bad. But if you're feeling good, then 10 days. But if you have a fever, you really need to be febrile for 72 hours. We really want to make sure that you are better before you're around others.
So do we think that there will be a state law to be fully vaccinated soon? And then I also got a question about this earlier. Do we think schools are going to require COVID-19 vaccines?
I don't know if it'll be a state law. I think that there are a lot of logistics to requiring citizens to be vaccinated. But what we are seeing increasingly are large employers, healthcare organizations requiring people to be vaccinated. We are seeing that establishments are requiring venues, bars and restaurants are requiring people to show proof of vaccination. And so I think that that's the way that we'll see being vaccinated will be pushed. Employers will require it to be in the workplace. healthcare organizations, and I've been on calls with healthcare organizations from across the state, where they just feel that, people expect hospitals and clinics to be safe places, and they don't expect that to be somewhere where they'll encounter someone who might infect them with COVID. And so I think that for that reason, a lot of healthcare systems have decided that they're going to require vaccination as a condition for employment.
I agree with that. I don't see, there's no other vaccine that's mandated as a citizen, as a general citizen. So I don't see COVID vaccine going along that route. As far as schools go, I think anyone else's guess is as good as mine. If schools mandate COVID vaccine, I really hope they mandate flu vaccine too.
Okay, we have a question about J&J. So I didn't hear anything about J&J. Do we have any information about that and booster shots?
I don't know if anything is coming soon, but I do believe, forgive me, I'm a pediatrician and we don't give J&J in kids, so I know less about it. But I do believe that's being studied and looked at, whether or not J&J is going to require a booster. My best guess is that it probably will, but I don't think we have as a definitive as a timeline as we do with the mRNA vaccines.
Yeah, that's correct. J&J, remember, was made the old way that we made vaccines. And I remind you that lots of other vaccines, whether it's tetanus or influenza, we give boosters to. But the current recommendation will be for boosters for the mRNA vaccines, which are the Pfizer and the Moderna. And there is not a recommendation right now for a booster for the J&J, but it's being studied, and that recommendation will probably come out later.
I see another question. Can you talk a little bit more about natural immunity and being immunocompromised? I'm both.
So that's one of the people. Natural immunity, I assume, would be someone who's been infected with COVID. And what we know is that the natural immunity that comes from COVID is not sustained as well as long as when you're immunized with one of the vaccines. So if you're immunocompromised and you've had a COVID infection, then you're surely not protected. And this is someone who will need to be vaccinated. Unless there's some other reason why their physician would not recommend it. But we know that people who have the COVID infections can get the Delta variant and get very, very sick. And so we don't believe that a COVID infection in and of itself offers as much protection as the vaccine, any of the vaccines that are out there. And someone who's immunocompromised, as we discussed earlier, we recommend not only they get vaccinated, but there will be a recommendation that subsequently they get a booster.
I would also add, I have read that some of the highest antibody levels are in folks who have been ill with COVID and have received a vaccine. That sort of combination of natural immunity plus vaccine has led to a very high level of antibody. However, if you throw being immunocompromised into there, I would not. You have to take a big step back on all of that. So I think even if you have natural immunity, which again, as Dr. Fagan pointed out, only lasts about 3 months, we believe. If you're immunocompromised, that's probably less. If you're immunocompromised, you need that third dose of vaccine, again, not as a booster, but to complete your series. We're hoping that a third dose gives you some protection. I would say even the combination of natural immunity plus 3 doses of vaccine, as an immunocompromised person, you still have to be extraordinarily cautious and masked and be careful whom you're around, because by definition of your disease, you still may struggle to produce antibodies. We're hoping to give you a better chance with third dose, but that's not a guarantee. I will say my kiddo with the kidney transplant who got his third dose yesterday is my only patient that has been approved for staying home from CPS for another year, because he is at such high risk of severe disease if he was to get COVID. So all of you in that immunocompromised category, please do get vaccinated. Please get those 3 doses, but please continue to be extraordinarily cautious.
What about kids with special needs? Do you think they can keep a mask on?
I will say again, it depends on the child, but I've been extraordinarily impressed with many of my patients with special needs who have learned to tolerate a mask. And for the ones who have struggled, we've worked with shields or hats that have kind of like a plastic shield on them so that they're not kind of like tight on their heads. I would certainly recommend some form, especially if they're under the age of 12 and too young to be vaccinated. I would definitely encourage you to find some way, work with special needs or otherwise. If you have kids who aren't very used to wearing a mask, please, please, please practice with them at home before school starts, because a lot of it is just getting used to it. Kids with special needs who have sensory issues, something on their face that they're not used to being on there, that's going to be a gradual stepwise process. And I'm sure that their teachers are going to have tactics that they're going to try to use to help them as well. But if a mask is an absolute no-go, I would work on shields before I went with nothing.
Great, thank you. We have another question. Can you please discuss if people are having any type of reactions after the third shot?
I haven't had anybody yet with the third shot, so I can't really speak to that. I can say that with the first two shots, older folks were less likely to have any type of reaction at all. We saw more significant symptoms in younger folks, but the most people might have some achiness, feel weak. As I tell them, it's nothing compared to getting COVID, and it's not a reason not to get vaccinated. But I can't really speak to the third shot. It's just that recommendation hasn't been out a week, and I just don't have anybody who's experienced it yet.
I would agree with that. It's such a new recommendation. And I always make the point that achiness, that feveriness, that yuckiness that you feel after a vaccine, that is not getting sick. That is your body doing the work. I have one of the great benefits as being a private pediatrician with COVID in my office is I can give it to everybody, the parent, the cousin, the grandma, the neighbor who show up in my office. I'm able to offer them all COVID vaccine. And many parents, when I ask them why they haven't gotten vaccinated up until now, or what the concerns are, they talk about their friends who have quote unquote gotten sick after their shot, meaning that feeling run down and fever and yuckiness and that you have for 24 to 36 hours. And I make the point, we tell you that can happen to your kid after every shot that they get, right? And we never kind of think of it negatively in that sense. That's not getting sick. That is your body doing the work. It's certainly uncomfortable, but it's not a bad thing, and it should not discourage you, because absolutely, I will take the 36 hours that I had run down after my second COVID shot any day over testing positive for COVID. And having weeks to months of long haul symptoms. Nobody wants that. But I would assume, we don't know, that people after their third dose might have some of those similar symptoms. And again, in those immunocompromised folks, again, that might be a good thing because it shows that immune system is working, which is what we're hoping for, especially in those immunocompromised patients.
So Kathy's asking, can I get the third shot early? I'm a K-12 teacher with some underlying conditions. 8 months will be in November.
It's possible. It's her physician has that available. They may be willing to give it to them early. I think we have to gear up again to giving the third shot, and not everyone's prepared. Like I said, this recommendation is fairly new, and we're just trying to get the vaccine out and distribute it so folks will be able to have it and start giving it.
And it would depend on what those underlying symptoms are. If you've got certain underlying symptoms, depending on what those are, and you have a discussion with your physician, you might be eligible right now to get that. Otherwise, we will see later on this week when the specifics come out for 8 months after, what sort of the caveats are that come out. So we'll have more information later this week.
Too soon to say.
Tom is asking, I've heard a lot about the vaccine affecting fertility. Is this an issue for women or men?
Neither. It's a completely 100% false, debunked myth that comes from the anti-vaccine community. They say it about HPV. They say it about all kinds of vaccines. I make the point, there's no known biological medical way that this vaccine or other vaccines could compromise your fertility in any way, shape, or form. So take that one. I tell patients all the time, when ask me about your questions about the vaccine. It's got a microchip, it's got metal. Ask me all your questions so I can put them in the categories of what's real and you need to be concerned about, although they're probably low risk and mild. And let me give you some perspective on, and then what's just completely false. And the fertility myth is in the completely false category.
Yeah. So what would you say to people, I don't see this in the chat, but I get this question a lot. What would you say to people who say, well, I have to wear a mask anyway, you know, I'm not really doing much anyway. Do I really need to go and get this vaccine?
Yeah, so the mask is a what we call a mitigating factor, but it is not as protective as the vaccine. And as we've said, is people who are vaccinated, even if they somehow are exposed and get infected, they don't get as sick as folks who are not vaccinated. And no matter how meticulous people are, there's some time where you don't think about it, you let your guard down, somebody's wearing a mask below their nose but cover their mouth, that they're exposed. We want to make sure you're as protected as possible. So it's really important that people go ahead and get vaccinated. You know, vaccine is the only way we're going to see our way out of this pandemic. Even with this current surge, we know that the vaccine is the one thing that's made a big difference. And the reason we haven't seen as big a spread, although we are seeing a surge now in Illinois, we're behind, you know, places like Texas and Florida. And why is that? Because we've been wearing masks. We've been getting vaccinated and we've been wearing masks. And both of those things make a big difference.
Tom's asking, what are other myths that you're hearing from patients? So besides the fertility issue.
So the fertility is a big one. Of course, I mean, there's people believe in the microchip and I don't have a lot of people that believe it, but they're like, doctor, there's not a microchip in it, right? Like they just want to hear me say, no, there's not a microchip in it. I have heard some concerns, religious arguments that have to do with vaccines and embryos. And I will say, I am a Catholic, and at the Catholic Church, the Pope has said that it is a greater sin to not be vaccinated than the sin that occurred many, 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 many years ago. And again, I want to make the point, this vaccine didn't come from some little aborted embryo. Generations ago, we took cells from a fertilized egg, not necessarily a formed person, and we have grown cell lines from there that we use in many vaccines, not just in this one. So I can't speak to all religions, but I know in the religion that I practice, the head of our church has come out and said, it is a greater sin to not be vaccinated than that original sin of that original abortion that we use those cell lines in. So there are those religious things that aren't necessarily myths, but that are things that you can speak to. I always say as a religious person, I don't think that God wants us to be sick. I don't think God wants us to get other people sick. I think God has given us the scientists that help us invent these advances that help us not be ill and not get other people ill. And I think the myth that the vaccine makes you sick is, you know, it's commonly, we hear this with flu vaccine all the time. I don't want a flu shot because it's going to give me the flu.
Right.
That is a biologically, medically impossible occurrence, right? Vaccines cannot give us the illnesses that they are intended to prevent, right? So are feeling run down or tired after getting a vaccine, like we've kind of already spoken about, is our body doing its work and making antibodies. It's not us getting sick. Breakthrough infections doesn't mean the vaccine doesn't work. Getting COVID less than 2 weeks after your second dose of a vaccine isn't even a breakthrough infection. That's that you haven't built full immunity to the vaccine yet. There's just people sometimes getting facts wrong. There are people that are saying 99% of people who are hospitalized and dying are vaccinated. Like that's just a misunderstanding of facts that are being told, or maybe are being told incorrectly in certain places. It's certainly the other way around. So those are the big ones. Those are the comments.
Yeah, so a lot of young people, especially college age, are worried about the fertility issue. There's nothing to that, and the idea that the vaccine will give you COVID is a big thing, and so that's a huge issue. Why we cannot get that group, the young folks between the 20 and 40-year-olds, to get vaccinated, which is a huge part of the people who are seeing sick now, who are winding up on ventilators, who are doing so poorly. And I think the other thing is pregnant women. There are a lot of pregnant women who say they don't want to get vaccinated. They don't want to expose their unborn child. But this actually may offer immunity to that unborn child. And we know that pregnant women and people who have recently been pregnant tend to do more poorly if they get COVID. And so I heard a tragic case from a maternal fetal medicine specialist about a woman who did not get vaccinated, got COVID, required intubation, required to be on a ventilator within hours of being admitted to the hospital, and then actually required ECMO, which was actually external circulation, putting her on a machine to oxygenate her. And she miraculously survived and delivered a healthy infant. But she spent 2.5 months in the hospital, left the hospital with a very healthy baby, but with permanently damaged lungs and was going to require oxygen for the rest of her life. And this was someone who we could have prevented that with vaccination. So it's important that pregnant women do get vaccinated. It's now the recommendation of the American College of Obstetrics and Gynecology. It's the recommendation of the CDC. So that you're exposing the unborn infant, what you're doing is going to protect them by providing them with immunity that they will receive from their vaccinated mother. So that's a real worrisome group that we really need to step forward and get them vaccinated.
I've seen some research that getting COVID during pregnancy can lead to poorer outcomes with your pregnancy. It can lead to losing a pregnancy. So we give other vaccines in pregnancy all the time. We give flu vaccine, we give tetanus vaccine, and we know in those scenarios, you do also pass immunity for those diseases to the fetus. So yes, the research that we have shows that it is safe. It is the official recommendation of the American College of Obstetrics and Gynecology. And as a lactation consultant, I will also say breastfeeding mothers as well. If you have chosen for some reason not to get your vaccine during pregnancy and you're breastfeeding, I would highly encourage you to get your vaccine. You also are passing a significant amount of immunity in that breast milk. And I tell these moms, these pregnant and breastfeeding moms, we don't know when we're going to have vaccine for these very young infants. And you're essentially providing them a significant amount of passive immunity when we really, other than our other mitigation strategies, don't have ways of protecting those. Young toddlers and younger kiddos are not the ones to likely bring COVID into a household, but with Delta, they are likely, this just came out this morning, to be spreaders. So if we can protect those kids by getting their moms vaccinated during pregnancy and breastfeeding, that's going to help with mitigation of spread as well.
I can tell you that I have a niece who's a pediatric intensivist who works in Florida, and she said there's nothing worse than having to come to a parent and tell them that you're going to have to put their child on a ventilator. And she's had to do it more often than ever in her career. And she said it's not fun because it's not a happy story.
Yeah, I think that's one thing that I hear a lot is, you guys said from the very beginning, young people don't get as sick as older people. Why do they have to get the shot? Why do people even in their 20s and 30s have to get the shot? You guys said that, they're not getting as sick as older people. And while
but that was the novel COVID virus, but we're now dealing with the Delta variant. The original virus was not as dangerous to young people, but the more the virus is allowed to mutate, the more dangerous it becomes. And so those folks who weren't as susceptible to the novel virus are proving to be extremely susceptible to the Delta variant. And, over 85% of what the infections we're seeing now are the Delta variant. So that's the variant you're more likely to get. It's more infectious. Everyone gets it, and it tends to make people sicker.
I will also say, I know that it's frustrating when science seems to be changing its story. And I keep making the point, the virus is changing. We're not, changing our minds. The virus is changing. So the mask, not mask, is because of a change in the virus. The kids don't get that sick, and now kids are getting sick is because of the change in the virus, right? So yes, to the point we were making earlier, it's 20, 30, 40 somethings that are in the hospital and intubated. It's not 60, 70, 80-year-olds. Most of those people are vaccinated at this point. So It's actually much less likely to see older folks in hospital and very ill. It's these younger folks, including more young kids and children. And I will say, even kids who aren't sick enough to be hospitalized or intubated, even kids who have mild disease, kids have long haul symptoms. Kids have fogginess, and fogginess in COVID, that COVID haze that we talked about, there's new research coming out saying that when we do PET scans, when we do imaging that lights up different parts of the brains, COVID fog looks like Alzheimer's disease in your brain. And that is something that teenagers can get and live with for several months. And again, that's not saying they have Alzheimer's, but that's how bad it looks on in their brains and on their PET scans. And most teenagers who get COVID will have some kind of neurological haziness, headache, fatigue issues afterwards. So the concept that kids don't get sick, that kids aren't severely ill, that kids aren't spreaders, that was an issue with the novel as well. We were saying, gosh, kids spread the flu and colds like crazy. Why aren't they spreading COVID? Kids are now spreaders. As we were mentioning earlier, Delta just reproduces at such a higher rate in the oral pharynx and in the lungs, the kids are going to be spreaders of Delta much more than our initial strains.
What would you say to people who, are wanting to wait a little bit longer? They're saying, FDA gave this emergency approval. I don't want to be a part of the experiment. What would you say to someone?
Yeah, we have to be better at more agile than the virus is, right? So people are having trouble adjusting to the fact that the virus keeps changing, and that, you need to get vaccinated now, because if you wait, we don't know what the next variant is, or, because Delta may be overtaken by another variant. And if we aren't able, this is an opportunity we have to seize it. And this is not an experiment per se. I think that the FDA has a very measured process that it's used for decades in terms of how they approve vaccines, how they approve medications. And they have not changed that timetable. But this virus is requiring us to act, as a society, to protect each other. And, waiting is just giving yourself more opportunity to get infected and get exposed. I know it's hard for people to adjust to the fact that the virus is changing so quickly, but that is our reality. And if we want to get through it, we're going to have to get vaccinated.
I make the point to my patients that we know from 70 years of vaccine history of giving vaccines since the polio vaccine, that if you're going to have a reaction to a vaccine, it's generally speaking going to be within 3 weeks of being vaccinated. If you look at the really long end, you're talking about 3 months later. People don't have vaccine reactions a year or 3 years or 10 years down the road. And we've given over 300 million doses of vaccine in the United States over the last 8-9 months. So we've had plenty of time. We've had plenty of research. The fact that this vaccine came out quickly doesn't mean it skipped any safety measures. We looked at all the things we normally look at, other than waiting those couple of years, which would have been unethical. If we had this vaccine that was this highly effective and this safe, and if let's say the FDA was still sitting on that and had not distributed it to us, and tens of thousands of people were continuing to die every day, we would be banging down their door for them to have released it sooner. I always urge people to not look at it as a rushed process, to be grateful at how fast it was able to be made, and that we've had plenty of time to see. And we do see these rare side effects, but that they are extraordinarily rare. And it is much more likely for you to have a bad outcome from COVID than it is for you to have a bad outcome from a vaccine. And every day that you wait is an opportunity for you to be exposed to COVID, for yourself to be ill. Right now, what we call the R of COVID is 8. Every positive person on average is going to infect 8 other individuals. So every day that goes by, it's the possibility for you to be infected, and for them to infect 8 people, and for those 8 people to infect 8 people, and for those 8 people to infect 8 people. Every time there is a person infected, it is the opportunity for the virus to change and mutate again and potentially become the next more virulent strain that maybe our vaccines don't protect against. So get vaccinated for yourself, for your loved ones, and for your community at large.
Great, thank you. So we just have a few minutes left. Any final comments from you, Dr. Fagan or Dr. Perez?
Yeah, I think that people who aren't vaccinated at this point, it's important for you to think about the people you care about. So that if you don't want to get vaccinated because you don't feel you're vulnerable, I say that if there's someone that you care about, you need to get vaccinated to protect that person. Whether it's your mama, your grandmama, your, granddad, or your kids. You need to get vaccinated for those who can't get vaccinated. You need to get vaccinated for our community to be safe. And so it's not just about you. It's about everyone you care about, and it's about the community we live in. And as long as we live together, we need to help protect each other.
I would reiterate all of those things. We need to pull together as a community and do this for each other. And my number one biggest message is, if you have concerns, or if you know folks, it sounds like most people here are believers in the vaccine and want to be vaccinated and want to do their best to protect others. But if you have those people in your family or in your community or in your group of friends that have concerns about the vaccine, encourage them to speak to their physician, because that's where you're going to get hopefully your best response and your best clearest answers. Like the examples I was giving about parents who come in with genuine concerns. They've heard about pericarditis and myocarditis. They've heard about quote unquote getting sick afterwards, which is really your body just doing the work. And when I can give them scientific, medically sound explanations, they can feel much more comfortable about making a decision that's based in science, not based off what Google said or what their neighbor said. So just encourage folks to go to reliable sources of information when they have their questions or their concerns.
All right. Well, great. Thank you so much, Dr. Fagan, Dr. Perez, for your time. We really appreciate it. Hopefully we can have you come back sometime in the future for another Ask a Doctor session. So thanks again, and thanks everyone who participated and for all of your great questions.
Thank you.
See you guys soon.
Bye-bye.